Obstructive sleep apnea occurs when the soft tissues in the back of your throat interfere with normal breathing while you sleep. These tissues are supported by bone structures of the jaw. Common treatment for OSA is a C-PAP, which uses air pressure to keep breathing airways open while you sleep. However, if C-PAP is ineffective for the patient, there are surgical options. Board-certified oral and maxillofacial surgeon Dr. Ralph Reynolds tells us about this life-changing procedure.
For obstructive sleep apnea, besides the gold standard, which is C-PAP, there are several devices and procedures that can be used. So one device is an oral airway device, and that basically makes you jut your chin forward and open up the airway behind your tongue. And it can be very useful in some cases if the patient has an airway obstruction back in that area. And it can be used in conjunction with C-PAP to lower pressures and make C-PAP more tolerable. The surgeries that can be done for obstructive sleep apnea include removal of tonsils. If the tonsils are big, then they may need to be removed. Also, there is orthodontic surgery, and that is a surgery that oral surgeons do. It's corrective jaw surgery. And for obstructive sleep apnea, what we try to do is move both jaws forward. And when we do that, we open up both the palatal airway and the retroglossal airway, the airway behind the tongue. And it's a permanent fix to obstructive sleep apnea.
I've snored pretty much as long as I can remember. And it turned into, when I came to get my wisdom teeth taken out, I told him beforehand that, I don't know if it'll hinder him that I can't breathe through my nose at all. And then it turned into, he'd, kind of kicked me back in the chair and looked at it, and he was like, do you snore? Have you ever had any problem sleeping? And I kind of just laughed and told him, yeah.
Our patient, Jeffrey, had a history of loud snoring followed by waking and gasping for breath. An at-home sleep test was administered through our office, and it revealed severe obstructive sleep apnea with an AHI of 74. Now that AHI is a number that measures how many times you stop breathing during the night, and that's a high number.
I was always tired and never really had any energy, so it would hit 4 o'clock and it was like, I'm just gonna go to bed. There's no point.
Well, Jeffrey's breathing was disturbed 571 times per night, and his blood oxygen dropped 362 times. So Jeffrey was prescribed C-PAP, and C-PAP is continuous positive airway pressure. It's that device that you strap on your face. It's a mask, and it has an air pump that pumps air and actually stents open your airway so that the airway doesn't close at night. The problem is he couldn't tolerate it. Look at this report on the computer. All of this spiky stuff right here is data, and the wedge at the bottom shows where Jeffrey falls in terms of obstructive sleep apnea. And wow, he is really up there. His AHI was 74, so he is on the high end of severe obstructive sleep apnea. So why does he have this problem? Jeffrey has an anatomical airway restriction. And this is demonstrated by his malocclusion, his bad bite, and his narrow palate. And this is why dentists are well positioned to identify airway problems. The roof of his mouth is narrow. His upper teeth and jaw bones are back compared to his lower jaw and teeth. And his upper teeth are inside his lowers. They should be outside. This leads to a narrow nasal airway, or nasal airway restriction. And that's because the floor of the nose is the roof of the mouth. The tongue space is also reduced, forcing the volume of the tongue back, and this negatively impacts the airway. Additionally, the narrow posterior palate, that's the back of the palate, is very important in terms of airway restriction. And widening palates has been shown to create significant upper airway volume increases. So what did we do? So we did a combination of surgical and orthodontic therapies to widen the palate and the nasal cavity and we move the teeth laterally as well as forward. And these procedures are called surgically assisted rapid palatal expansion, which is nicknamed SARPE, S-A-R-P-E, with a maxillary skeletal expander. And so this is an expander that sticks on the palate and cranks the palate open. And SFOT, which is surgically facilitated orthodontic treatment. And this involves tiny osteotomies, which are cuts in the bone, around all of the maxillary teeth roots, and also cuts in the upper jawbone to partially separate it from the facial bones. Then a mid-palatal split, and separating the nasal septum from the floor of the nose. During that procedure, we simultaneously do the osteotomies and place the expansion device. And this device is placed in the roof of the mouth. After the procedure, over about a 1-month period, the palate is slowly expanded, and this grows the bone wider. Also, the teeth are orthodontically being moved, and they move 3 times faster than usual because of the little osteotomies between the teeth.
Yeah, so obviously I got braces on right now and a giant gap. They told me I'm about halfway through or so at this point. So probably between another like 3 to 6 months and I should be pretty much back to normal per se, if not obviously better. The snoring, it only took a few days after the surgery that it's pretty much gone. That it very much like it was kind of a crazy turnaround from not really knowing what sleep is to now I can sleep. I like playing basketball, and it was always like I'd, play half court and like, well, I can run for about 5 minutes total. Now I very much like I have the energy to actually play. It's kind of incredible. Yeah, I very much at this point I feel like there was, me before the surgery that was like, oh yeah, I'd sleep and try and be active and it wouldn't really go anywhere. And now I feel like there very much is like the new life of I get to go out and do things and feel like I'm okay and I can function and live like a normal person.
Obstructive sleep apnea is a serious disease that sometimes benefits from surgical intervention.
At Reynolds Oral and Facial Surgery, providing their patients with the best care possible is at the core of everything they do. They understand that their patients may be experiencing a wide variety of emotions, and they do everything they can to make their experience as comfortable as possible.